So one question I heard actually just on the side is, my medical degree is DPM, so what does that stand for? So that's Doctor of Podiatric Medicine. So my specialty is podiatry, and then also foot and ankle surgery. So I did my undergrad up in Duluth, and then I made my way south down to Des Moines, Iowa for my medical school, and then came back up, slowly kept coming back up north, did my surgical training in the Twin Cities, and then now made it back up here. So I've been with Essentia Health for about 3 years now. So back to podiatry then, what do I do, what can I do for you? So really, the Essentia Health Podiatry Department is anything and everything foot and ankle. Diabetes checks, toenail checks, circulation problems, flat feet, injuries, sprains, fractures, broken bones, anything and everything you can think of, you can always come to us first, and if we can't help you, we're going to know who to get you to, okay? So peripheral neuropathy. Peripheral neuropathy is actually quite a common problem. It occurs in about 8% of population of 55 years and older. And then in the diabetic population, which is the most common reason for peripheral neuropathy, it increases from there. The studies say it ranges from 30 to 66% of people with diabetes will have some sort of peripheral neuropathy. So it is quite a prevalent problem that really causes a lot of problems for people. Some people can have very mild cases. Some people can have very severe cases. There's quite a wide range. So today we're just going to go through from start to finish kind of what it is, what does it mean for you, and what can we do for treatment. The most important thing, because this is so prevalent in diabetes, if you are a diabetic, you want to make sure that you're having your annual testing basically with either your primary care doctor or a podiatrist to be checking for this problem. So mild neuropathy usually starts in the feet. As it increases, it spreads to the knees, and we'll go through what that means, symptoms there. And then severe cases, some people can be numb, their entire leg is numb, and then even their hands can start to get numb as well. So there's several different types of neuropathy, not as important for you, but just to let you know that there's many different symptoms. It's not just my feet are numb. You know, that's not the only symptom of neuropathy, and just because your feet are numb, it doesn't mean you have neuropathy. So it actually is a much more complicated medical condition. So we'll try to kind of break it down in pieces and make it a little bit easier to understand. The most common type of neuropathy affects your sensory nerves, meaning your feeling. So what happens is you can get this prickling, tingling, burning sensation. And then it can turn into a loss of sensation to where you can't feel anything anymore as the disease progresses. So that's the sensory nerves. Other people, less commonly, they affect motor nerves, which means maybe their reflexes don't work as well, or their muscle strength, they're kind of weak. And then there's a less common autonomic nerves, which some of the symptoms of that are early satiety, meaning you just feel full right away. You don't really eat much and you feel really full. Orthostatic hypotension means that when you stand up too quickly, your blood pressure drops, and some people can kind of black out essentially, or they feel like they're going to faint. And then sweat abnormalities, too much sweating, not any sweating. So these are very, very uncommon symptoms of peripheral neuropathy. So again, this is looking at the big picture. Not everybody is going to fit into just one box for these symptoms. So more specifically then, the common ones that I hear are I feel numbness. Usually when neuropathy first starts, someone comes in and they say it doesn't really hurt, but I just feel numbness. My feet, my toes, they just feel numb. I don't really know what's going on. As it gets worse, then people say, okay, now I'm feeling a little bit of a tingling and burning. It's kind of starting to hurt. Stabbing, electric shock, shooting type pain are pretty common to hear. Pins and needles, it feels like there's ants crawling on my skin. Most people with neuropathy, especially diabetes-related neuropathy, it seems to be these symptoms are worse at bedtime. They say, I'm good during the day, I'm walking during the day, it's fine, but when I try to go to bed, I can't sleep. It's just like there's pins and needles, and I can't fall asleep. So that's pretty common for people. A lot of times during the day, you are having some of these symptoms, but you're busy walking, you're busy doing your day-to-day things, you're not really paying attention. So when you get ready to go to bed, you actually get a chance to sit down and relax. That's when you really feel it a lot of the times too. Neuropathy usually starts again then in the toes, and it usually starts on both sides of the feet equally. So it kind of starts at the very end of the toes, and it will start to work its way up, kind of into the middle of the foot, up the ankle, and then up the leg. The more severe cases of neuropathy can start in the hands, but usually it affects the feet first and then goes up into the hands. So a severe neuropathy patient doesn't have good grip strength either. They really just can't feel very well with their hands. Once you start to lose some of that sensory nerve function I was talking about, you get the numbness and tingling. Then it turns into the prickling, burning, electric shock. And then once enough nerve damage is done, that's when you lose feeling completely. A lot of people just, I could grab their big toe and they just have no idea that I'm feeling the big toe. So then we move into the lack of feeling. This does usually spread very slow. Again, you kind of notice it's numb, and then you start getting into the pain and the other things. If neuropathy spreads very fast, that's usually a concern of a more concerning disease process, not your typical diabetes spreading process. So then we get a little worried that maybe there's something else going on, maybe another disease that we need to look into. Again, the less common symptoms then are, as the neuropathy gets worse, people start to notice weakness problems, poor balance problems, and poor reflexes. A lot of those things you don't necessarily notice yourself. It's the things that we test for in clinic that we kind of notice a little bit more. You wouldn't necessarily notice on your day-to-day. So the causes of peripheral neuropathy. I already said diabetes is the most common. So 30 to 66% of patients. So that's quite a significant amount of the population, especially as diabetes continues to rise within our population as well. Why do people with diabetes get neuropathy? So what happens, the process of diabetes is, of course, it's increased blood sugar. So this increased blood sugar will start to basically deposit everywhere. So diabetes affects your nerves, it affects your blood vessels, so it affects the tiny blood vessels, so your toes and your fingers and your eyes. That's why a lot of diabetics have problems with their eyes, is because it affects the tiny blood vessels. So then it starts by affecting the tiny nerves as well. So it basically deposits on these nerves and it starts to cause nerve damage. It becomes toxic to nerves. So that's why diabetics will start to get neuropathy problems. Another common cause of peripheral neuropathy is a side effect of medication. Now, the most common medications to cause this problem are going to be like a chemotherapy, those really toxic drugs that we know cause a lot of problems. So chemotherapy drugs are a big one. And then there's a couple other ones that don't cause neuropathy in everybody, but can cause neuropathy. So if someone has these problems, it's certainly something we look into. Kind of look at your medication list and see if we can rule that out as a problem. Excessive long-term alcohol use. So there's a couple different reasons why alcohol use can cause neuropathy. One is it being toxic, again, to the nerves themselves. A lot of alcohol can cause damage directly at the nerves. Another reason that alcohol use can cause neuropathy is actually vitamin deficiency. So a long-term alcohol abuser often isn't getting the nutrition they need, so they're lacking vitamins. And there's a vitamin deficiency that can cause neuropathy as well. We'll get to that. That's vitamin B12. So a lot of times alcoholics aren't eating well, they're not getting their vitamins, so then the lack of vitamins can cause peripheral neuropathy. Now I always get the question of, well, what's excessive long-term alcohol use? What does that mean? It's not necessarily a certain amount where if you surpass this amount, everybody's going to get neuropathy. It's a little bit different for everybody. But in general, the definitions then of alcohol abuse, one is binge drinking. So in one sitting, one occasion, one afternoon, a couple hour setting, if a woman drinks 4 or more alcoholic drinks or a man drinks 5 or more alcoholic drinks, that's considered binge drinking. Alcohol abuse then, or heavy alcohol use, is binge drinking 5 or more days per month. So I had a patient actually just the last few weeks who had neuropathy, and he knew he had foot numbness, but he didn't really know that it was neuropathy or know what it was from. And he subsequently developed problems. He couldn't feel anymore, and he got a big sore. He got a big ulcer on his toe that became infected to the point where we had to amputate. So that was a big case where, I asked him, we went through the reasons of neuropathy of what it could be. He didn't have diabetes, he didn't have chemo, he didn't have any of the big ones. And I got to alcohol use. And he said, well, yeah, I used to. Drink a fair amount. And I said, well, what does that mean to you? What's a fair amount? Well, it turns out he was drinking a liter of alcohol, hard alcohol, every day for 8 years. So that, to me, that is heavy. That is heavy alcohol use. And that is why he had neuropathy. So it's not a drink a day. It's not a couple drinks a day. It's a heavy, substantial amount that, yes, you very well can get neuropathy from that. So again, I was mentioning the vitamin B12. So that's a very common vitamin to cause neuropathy. So a lot of these, if we can catch them earlier enough, then we can kind of try to reverse some of these symptoms. So an easy one is vitamin B12 that you can take over the counter. If you're very, very deficient, then sometimes we'll get you a stronger prescription. Sometimes people get injections. But in general, that's an easy over-the-counter one. Direct nerve injury can cause nerve problems. So an example of that would be carpal tunnel. That's a pretty common problem a lot of people seem to run into. So if there's constant pressure or pushing on a nerve, like in carpal tunnel, that can cause neuropathy symptoms. There's a similar process in the ankle called tarsal tunnel. So any extra pressure, problems at the ankle can cause tarsal tunnel, which can cause neuropathy problems as well. There's some rare inherited diseases. One specifically is called Charcot-Marie-Tooth disease, and a hallmark of that disease is peripheral neuropathy. It causes a lot of other weakness and a lot of other problems. So that's one disease that causes neuropathy. Another big one is we don't know. I do have a fair amount of people that have this, and we just don't know why. We can't find a medication reason. They don't have any other medical problems. We just can't explain it. We just call that idiopathic peripheral neuropathy, meaning you just have it, we have no good reason for it. You're just one of those unfortunate ones, I guess. And then there's many, many, many more very rare, less common reasons for neuropathy. So if you have neuropathy that's progressing, and we've kind of checked off all those boxes that some of those big diseases aren't the problem, depending on how bad your symptoms are, then we may start looking into these less common reasons. So sometimes the thyroid can do it, blood flow problems can do it, infections. There's some studies that say Lyme's disease can cause neuropathy, HIV and AIDS, tumors, and different, basically inflammatory diseases. So your body's kind of attacking these nerves for one reason or another. So these I won't really get into it all today because they're very rare. It's not a common problem. And most people, we don't get too worked up of these things. So how do we test? How do we know then if we have peripheral neuropathy? So one test we do is we're trying to check those sensory nerves, the sensation on the bottom of your feet then. So there's a little thing called a monofilament wire. It looks like a little fishing wire, essentially. It's just a monofilament. And it's a very specific amount of pressure that it applies to the foot. So what we have you do is we have you close your eyes, and then I touch your foot with this little wire, and you tell me if you can feel it, and you tell me where. Sometimes I'll kind of push on the big toe, and someone says, yeah, I can feel that in my heel. Well, we know your nerves aren't properly working if you can tell there's something there, but you can't quite tell where. Okay. So an alternative to this monofilament is a little cotton swab. You just kind of pull apart a little cotton swab a little bit and touch the bottom of your feet and see if you can feel that. We test your pain, a slight little pin prick. We're not trying to torture you in clinic or anything. So sometimes we'll kind of break off a Q-tip and kind of touch you with the sharp end of the Q-tip and see if you can feel that. So a lot of times with neuropathy, you don't even feel that light pain sensation. And then proprioception. So what that word means is where, for example, your big toe, where your big toe is in relation to your foot. So I have to, if I move the big toe up, you should be able to tell me that I moved it up. If I move it down, you should be able to feel that I'm moving it down. So some people, if I have you close your eyes, they can tell that I'm moving the toe, but they just have no idea which direction. They can't tell really where their toe is. So that's another sign of some nerve damage. Vibration. Vibration is actually a really good one that I think gets missed a lot. What we do is we have a tuning fork. And if you hit a tuning fork, it's going to vibrate. and I can feel that tuning fork vibrate in my hands. So what happens is we put it on your foot, and if you have nerve damage, you won't be able to feel the vibration of the tuning fork. So if I can feel the vibration in my hands, but you can't feel it when I put it on your foot, then again, we know there's some nerve damage happening. So that's kind of an easy test too. We check your reflexes, so the big one in the foot is the ankle, and we check your strength. Now with peripheral neuropathy, it's not just one of these, so let's say you can't feel the vibration. Just because you can't feel vibration alone doesn't mean you have neuropathy. So it's kind of a big picture. It's more than one of these tests have to be positive before we really get worried about peripheral neuropathy. So studies have shown that most people 65 and older have trouble feeling the vibration anyway. So that's why I say if you go home and try some of these things, don't make yourself too scared. You know, it's more than one thing that has to be going on before we consider you to have neuropathy. All right, so this video, I don't think we're going to be able to get to work then. It was just going to demonstrate a type of walk, uncoordinated walk, that people can have when they have neuropathy. So we called it an ataxic gait, which basically means it's very uncoordinated. When you get weakness, your nerves aren't giving you that feedback of how you're walking. And I'm going to try to demonstrate, don't laugh at me, okay? So it's a very, very wide gait here. People kind of shuffle, but then their upper body isn't very coordinated. They can't walk in line, so their upper body kind of swings. So you kind of see these people, it's a really wide stance gait, and they just are really uncoordinated looking when they walk. So again, an ataxic gait, if someone has that, it can be due to other things too. Neuropathy is not the only reason, it's a big picture thing. A lot of people will test how you walk. People can't walk from heel to toe. So when they try to walk from heel to toe, they just fall over because they just have no balance, and again, they're just too uncoordinated to be able to do that. And as I keep hitting on, it's a combination of all of these things to be accurate with this diagnosis. So testing, then we may move on to some blood work. So we'll check your blood sugar if we're worried about diabetes. I already mentioned vitamin B12, so we'll draw that level as well. And then we get a list of other things here to check your kidneys, check your liver, check your thyroid, kind of do some digging here as a big picture, what else is going on? Could there be other disease processes that could be causing this problem? So the doctor will draw blood work. Now, there's a test, a nerve conduction study, to test the function of your nerves. Anybody in here ever have one of these, an EMG? Do they hurt? I heard they really hurt. Yes. So what they have to do is they put little needles into your arms or legs or wherever they want to test the nerves, and they're checking the function of how these nerves kind of control your muscles, and they can actually test the speed at which these nerves work. So there's all these different things that they're testing, and that helps kind of tell us if the nerves are slow, what type of nerves are affected, and again, that just adds to the big picture of, okay, that looks like there's signs of neuropathy, and this is what kind of neuropathy it could be. What happens is I get a report back that looks like this. I have no idea what this means, okay? One thing about being a doctor is you got to recognize what you know and what you don't know. I don't know this. That's not my specialty. So that's the neurologist. So this is a team effort then. So we rely heavily on the neurologist to tell me, well, what does this mean? You know, what nerve fibers are working, which ones aren't working, and how does that help us with what the cause of this problem is? So this is basically a recording of your nerve's electrical activity. It just comes back in a graph, and I get a bunch of numbers, and that's where I let the neurologist interpret that test then. Usually it is a neurologist or a nerve specialist that does this test. Now, not everybody has to get this test. If we're pretty confident that this is from diabetes, or like my patient earlier was talking about, we're pretty confident this is from long-term alcohol use, well then we don't need to do this test because we already know your foot's completely numb. We know the reason why, so then there's no reason to do a painful test. This test is if we just can't figure out why. You know, what are we missing? What's going on? Where's this neuropathy coming from? Then we will order this test. Less common things. So I haven't done really any of these things to test for neuropathy. There's certain images like an MRI or scans that you kind of can look at nerves in various areas. This is an example of nerves in the brain. Testing the sweat function, or we actually take a biopsy. You actually cut out a sample of the nerve and test that. These things are really only for those very severe neuropathy cases that I was talking about. We don't know where it's coming from, but we got to figure it out because these symptoms keep getting worse. Then we make it into some of these things, but it's quite uncommon to do this stuff.
The sweat, when you talk about sweat functions, at your feet, or your head?
Yeah, so everywhere. Most of your sweat glands, palms of your hands, soles of your feet, underarms could be tested. Too much sweating, not enough sweating, people can have problems with. So how do we treat neuropathy? So this is probably one big reason why people came today. Pretty common problem. Well, what do we do about it? If I had a cure for peripheral neuropathy, I would not be speaking to you here right now. I'd be retired on a beach somewhere. We just don't have a great cure for it, okay? So it's very frustrating. It's a very frustrating condition to treat. So the first thing we need to do is identify the cause, which we were just going through. What are the reasons? If we can identify the cause or the reason for having neuropathy, then we can help figure out how to treat it. So then we can treat the disease. Once we get that figured out, we can figure out how to prevent your symptoms from getting worse. And then we can get to actually treating the pain and the symptoms that you have left. So treatment then, again, because the most common cause is diabetes, the biggest thing for diabetics is to keep their blood sugars under control. Studies have told us, and we know that the higher the blood sugar, the worse the neuropathy symptoms, the worse the burning, tingling pain that people experience. So getting those blood sugars down seems to really help that. If we know it's a medication that's causing it, certainly trying to switch or stop medications. Some of the medications say it's from chemo. That's a pretty common cause for neuropathy that I see. Unfortunately, the damage is done. So then we need to take that into consideration. You can't, you've already stopped your chemo medication, then likely you're not going to get that nerve function back. Then we get into how do we manage these symptoms now that we know they're here to stay, because we can't take back the chemotherapy. Getting you on vitamin supplements to replenish anything that's lost for various reasons. And then the cases of like carpal tunnel, or if there's chronic nerve damage from pressure injuries, then you talk about the splinting, bracing, padding options to kind of protect those nerves. This is, for my patients, this is an uncommon reason to really get neuropathy. So for diabetics or medications or the typical peripheral neuropathy that you think of, there's not really any good splinting or bracing options that seem to help, unfortunately. So getting into the medications, there's actually a lot of different medications that can be used to treat neuropathy. The key is you need to speak with your primary care provider about which one's the best for you, because these medications can interact with your other medications. There's not just one that works for everybody. Every medication has its side effects, so we need to take side effects into consideration, especially with the other medical problems that you may have as well. So there's many different kinds, some antidepressant medications. So if you also suffer from depression, maybe that's a good one to start with because it can help treat both conditions. There's anti-seizure medications. Now the two big ones that people seem to hear about are Gabapentin or Neurontin. I believe that's the most common one that people seem to be on. And then Lyrica. Lyrica is a big one that you see especially in commercials, advertisements on TV. So we'll get into those a little bit more here. Muscle relaxers, I don't see used as common. They help a small amount of people. So if some people are trying these other medications and they're not working, then maybe a muscle relaxer is another one to try. There's been a lot of research on gabapentin. So this is probably the best medication that we have right now to treat neuropathy. And of course, it doesn't work for everybody. Like I said, I wouldn't be here if we had a good treatment for everybody. I'd be happily on a beach. But you take it 1 to 3 times per day. So the hard part about gabapentin or Neurontin is there's a huge dose range for everybody. It takes a little while, and it's kind of a trick to figure out what's going to work for me without causing side effects. how much do I need to take before I start feeling too sleepy? So the biggest side effects are dizziness, sleepiness. So a lot of times we have you start taking it before bed so we know how your body's going to react. Because otherwise, if you take it first thing in the morning and you go and jump in a car, you get into a car accident or cause problems, because these really can cause dizziness, spells, and sleepiness. Some people get water retention, or they actually have problems walking from gabapentin. But the most common side effects I see are the dizziness and the sleepiness. So you can take it up to 3 times per day. Usually, so you start at 100 milligrams, you work up to 300 milligrams of one pill, and then you can even get up to 900, 1200 milligrams at once. So like I said, it's a huge range of where this medication is going to work for you. So that can be frustrating for people, because you just want relief. You want something to work. So you start this medication and you're hoping it's going to work, and then it takes a long time to tweak it. So be patient and before you give up on it, and see if you can't figure out the right dose for you. Lyrica then, like I said, this is the one that you really see on TV a lot. Lyrica is a brand name medication. So a lot of times it's not covered by insurance very well. What I see is people usually have to try and fail gabapentin before your insurance will let you try Lyrica. That's kind of the most common thing that I see. Another medication though that has been proven to help neuropathy, but of course it comes with its own side effects. Dizziness and sleepiness, again, this one can cause a little bit more headache, blurred vision problems, diarrhea, and swelling. To go back, there's been research that shows that about 1 in 10 people will suffer side effects from gabapentin. I couldn't find a good number like that for Lyrica, so I don't know how many people have problems on this medication. Some of the bonuses of Lyrica is it works faster. Kind of that gabapentin, I said you really got to trial and error and figure out what your best dose is. Lyrica seems to kick in faster, so it's a little bit easier to find the dose that you need. Some of the topical treatment options for pain are capsaicin is probably my favorite. I like to tell patients to use that kind of at bedtime. So it's I can't fall asleep, the burning, tingling pain, I just need some rest. That's where the topicals come in, because they're short-lived. We know they're not going to last all day. So it's kind of a nice thing to just help you get to sleep. Now, one of the catches with capsaicin is that it's made of peppers. So when you first put it on, there's actually a burning sensation when you first put it on your skin. So you have to make sure you wear gloves, or you wash your hands really good when you're done. Because I've had patients where they touch their face, they put on this cream, and then they touch their face, and now they spent the whole night with their face burning. And that's not very fun. So you got to be careful with that medication. But as far as a topical cream goes, that's probably the one that I see works the best. Again, doesn't work for everybody, but works the best compared to some of the other ones. There's like a lidocaine cream or a lidoderm patch, so that's basically numbing. So that's just trying to numb the nerves in the skin. So that works for a very short time for a very small area. So may help you before bed, but not going to be very long lasting. Other treatment options. I wanted to get a little bit into this because I have patients that come in and they'll bring me a newspaper article that says, come have dinner and learn about this brand new great treatment for neuropathy. And they say, what do you think about this? Should I go? Is this going to work? And basically, I've never heard of one of those working. I've never had a patient come back and say, yeah, it worked great. That was fabulous. I get the irony of, you guys are here having lunch here today, but don't be fooled by those newspaper articles that talk about coming in and having dinner and learning about a new treatment, okay? Some of those sponsored things, they're just out to make money, and the research isn't really there yet to prove that these things are helpful. So that's what we're running into. So there's a lot of different things like spinal cord stimulation, people who have been to physical therapy or have TENS units, so another way to stimulate the nerves. Lasers, there's different injections. I know there's a really big injection clinic somewhere in the Twin Cities that a lot of people try to go to. And again, I haven't had anybody come back and say, yeah, it was worth it. Most of them say it didn't seem to do anything at all. Acupuncture and yoga are two other things that some sources say that they work. Now, here's the catch with these things is, some of the injections and laser therapy make me a little nervous. They could make me worry that they could actually do some harm. Things like acupuncture and yoga and creams and herbal medications, well, they're certainly not going to hurt you, so I'm okay with those. They're worth a try. I just get worried about some of these other invasive things. So the research for these things, for one, there's just not a lot of research. There's not a lot of studies studying these things in relation to neuropathy. And then the other problem is the studies that are out there, the studies that are available, have shown that the patients who didn't actually get a treatment but thought they got a treatment actually did better than the patients who got the real treatment. So the placebo effect. So with all of these things, all the studies, they're not good because they're showing us that the people who actually didn't get anything at all felt better. So I don't put a lot of stock into these things then because the placebo patients. So the question is Aspercreme with Lidocaine seems to be helping a little bit for these symptoms, but how much can you safely use? I have to defer to directions on the box. Usually they're a once or twice a day kind of thing. Some of the problems with the creams is especially the lidocaine. If you're using the lidocaine over and over and over again, you can actually cause damage to the nerves that way too. And then as far as the creams goes, creams in general, if you're trying to put creams on all day, then you can actually cause skin irritation and cause kind of rashes and problems with the skin that way. So for the camera then, the next thing was hemp oil. He's found some relief with regards to this pain and other aches and pains. Same with the capsaicin cream. That's not just for neuropathy. That can be used for arthritis and other aches and pains. With any of that stuff, we're getting more research about it, especially as medical marijuana and things like that are getting legalized. So I have had actually just one patient who thought that marijuana helped his neuropathy pain, and he was trying to figure out where he could go to get the medical marijuana. Well, Minnesota's not, we're just not there yet with a lot of it. So I think there's one clinic in St. Cloud maybe that does medical marijuana. So I don't have any good research proving any of those things, unfortunately, at this point. But I think, I'm assuming some of that should be coming within the next few years, more on that stuff. So the part that concerns me a little bit more now, of course, is your foot care. So you've got this neuropathy, you've got the numbness, you've got the pain. Let's say we get some of these symptoms under control, but you get to a point to where you can't feel anything anymore. And a lot of my patients get this far. My patient from earlier that I was talking about, the only reason that he knew he had a problem was one day he was walking to his kitchen and he had white linoleum and he saw a trail of blood on the floor. And he thought maybe the dog, he couldn't figure out where the dog was coming from. So he started to trail the blood and he figured out that it was his own tracks. So he had a sore on his foot. So that's where I come in a lot of times, unfortunately, is that this neuropathy is caught too late. So once you get the loss of sensation, you have to take good care of your feet. You have to wear shoes in the house. I think I might get ahead of myself there a little bit, but so you're checking your feet daily. Any new sores, any new wounds, scratches, cuts, you really need to monitor because these can actually get worse on you very quickly because you just don't feel it. You don't have that natural response to pain. So if I cut my foot, I'm going to say, gosh, this really hurts. I need to change the way I walk. I got to get a bandage on this. I got to treat this. Someone with neuropathy, if they have a sore on their foot, a lot of times they're pressure sores, so it's from chronic pressure. Well, they don't know what's there. So they just keep pressing, walking, and the wound just gets bigger, deeper, and gets infected. So anybody with neuropathy should be doing daily foot checks, checking for anything concerning. If you can't see, use a mirror to look at the bottom of the feet or ask a family member for help. Really should be making sure your feet are cleansed daily, checking in between the toes. A lot of sores can kind of hide in between the toes because that's not if you think about when you shower, how many people are really reaching down and trying to get in between their toes? I mean, it's kind of the last place you kind of think about. We actually don't want foot soaking. The reason I say that is with a neuropathy, you're at a higher risk of infections. So with long foot soaks, you're actually just letting bacteria kind of thrive and kind of get deeper in that wound than it otherwise would. So if you're going to soak, 5-10 minutes, and you need to make sure you're checking that water temperature. So you can't check it with your feet because your feet are numb. Your feet aren't going to tell you how hot that water is. So you need to check with your hands. If you have neuropathy in your hands, you need to check with your elbow. So you should be checking that water temperature, because I've seen it. I've had patients that soak their feet, they put it in scalding hot water, and now they've come in and they got burns and blisters over all of their feet because they just don't know. Or family members too. If you're making a bath for someone else and they have neuropathy too, I've seen that as well, where they accidentally make the water too hot. Same goes then for heating pads. You don't want to use a lot of heating pads or ice packs because you can't tell that it's too hot or too cold. You can't tell that it's causing more damage to your skin. Never cut off corns and calluses yourself. This one I struggle with. This one, people will come in and say, I have a box cutter at home, I can take care of this. No. You let me do the sharp. Anything sharp, okay? Let us take care of it. A lot of people get creative at home because it's hard to come in, it's hard to see me, but it really is important to let us take care of any of that sharp trimming, because you can accidentally go too deep on your own and then you're not going to feel it, and then you're left with a pretty big hole in your foot instead of just a callus on the foot. Stop smoking. Of course, we say that for a multitude of reasons. I mean, just your blood flow, effects on the nerves. I mean, it's big picture. Just in general, smoking can cause a lot of damage to your feet, actually. So as far as what to do, you want to wear light-colored cotton socks. The reason being, if you do cut yourself, then you can see the blood on the socks. A lot of people, if they wear black socks, you can't see the stains, and you don't know that you've got something draining there. Nothing that's too tight that's going to cut off circulation, because again, you're not going to feel that and you're not going to know there's a problem. Wearing socks and shoes at all times, even in the house. This is another one that people really struggle with because they like to go barefoot. I can't tell you how many times I have people come in with needles in their feet and they have no idea because they're barefoot, they can't feel it, they have neuropathy. They'll be in for something totally different. We take an x-ray and I'll say, oh, do you know you have a needle in your foot? And they're like, no, when did that get there? So you just don't feel it. So it's important to have protection then. Socks and shoes in the house at all times. Even if that means you have a designated pair of house shoes then that you don't wear outside. Even if it's a slipper with a thicker sole, not a really flimsy slipper, because stuff can poke through slippers too. But you want to make sure your feet are always protected. And then getting your shoes fitted. So that's another thing is, if your shoes are too tight but you can't feel it, you're going to get sores and you're going to get problems at the tips of your toes. So having someone help you get measured. If you're a diabetic, diabetic shoes are always measured for you from usually a diabetic shoe store, so that's helpful. But otherwise, going to a shoe store to help someone actually size you is important. Bottom line is contact us right away with any new problems. So if you have a new cut or you have a new sore and you say, I don't know, I can't really tell if this is a problem or not, just come in. Let me decide if it's a problem or not, okay? Because it very well might be. And if it's not, well, perfect. We don't mind. I'd rather just get you checked out to make sure you're doing okay. So that's not a problem at all. So when do we send you to a specialist? When do we send you to a neurologist or a nerve specialist then? You start with us. You start with your podiatrist, your family medicine doctor. If you think you have some of these symptoms or problems, we get the workup going, kind of start taking some of these tests and figure out which road we need to go down. Majority of cases of neuropathy we call mild to moderate. So we see them all the time. We know how to control those. We know kind of which avenues to go to treat them. If we find that you have very severe symptoms or symptoms that are really uncommon, doesn't really fit, if they're spreading really fast, if all of a sudden you just really have a lot of problems walking and balance problems that you never had before, anything severe like that, if we don't know, if we're uncertain as to what's going on, then we'll get you to a neurologist. We'll get you to that nerve specialist. So in conclusion, there are many different reasons for peripheral neuropathy. We went through a bunch of those today. Bottom line, though, is that you need to see your doctor to help get that diagnosed and kind of figure out what is the reason. From there, we can figure out there are many different treatment options available. There's just not one thing that seems to work for everything. So that's the most frustrating part of this condition. So if anybody's interested in light medical reading, here's a couple options for articles there. Otherwise, my other team members, so I do come to the Pierz clinic on Monday afternoons. My other partner is Dr. Bartle. She's in Brainerd, and she's actually starting to go out to Wadena, so we're kind of spreading out a little bit, so that's pretty exciting. And then Dr. Zenek is our newest addition. He's been there about 9 months or so now, and he is starting to go to our Pine River clinic. So we're really excited to be able to spread out and offer some podiatry services to our patients outside of Brainerd. Thank you.